Thank you, ma'am, and good evening. Whenever a surgeon is faced with doing manual capsulorhexis in an intumescent cataract, there is no guarantee, I said 100% guarantee, that the capsulorhexis will go exactly the way it should go, however the skilled the surgeon is. Well, most of the time we get over the tide, but it is not always. Why it is so? Little bit of basics. In maturity, when the cataract becomes mature, the cortical matter gets partially liquefied, and that gradually increases the intralenticular pressure, and it stretches the capsular back, anterior and posterior both. And when that happens, when the stretching happens, so whenever we put a nick anywhere in the center, the fluid tries to egress out of the capsular bag, and during that process, either it can go smooth or it can go haywire. It depends on the intralenticular pressure and certain other factors, which is not the topic of discussion here. And we can, like we have put a nick here and we can see the milky fluid coming out, and it is between that nuclear material and the capsule. We all know the basics, nothing great about this. So what happens, we can land about in complications like this, a runaway rhexis, and even in extreme cases like the Argentinian flag sign. And this can be catastrophic. Even there can be nucleus drop, or we can have to convert into a manual method, or we can abort the plan of surgery. And we know that this is the day of simply not cataract surgery, but we are promising refractive cataract surgery. So the whole plan goes haywire, and then we are stuck up. We are basically salvaging the eye. We are trying to give some vision to the patient that used to be given 20 years back. So what is the solution? Things like that. Even if you manage to do with a hypermature cataract capsulorhexis, you get a suboptimal result. Small capsulorhexis, big rhexis, eccentric rhexis, that in future case, in future that optic will pop out, and there will be refractive surprises. So what is the surprise? What is the solution? Here Zepto comes as a hero. Why Zepto comes as a hero? Zepto comes as a hero because it gives a very predictable result, and contrary to our mental block, it is a very simple to use machine. Just to show the animation, just about the machine, it consists of two parts. That's the handpiece, which is basically a silicone suction cup, which can be folded and can be inserted through a small incision, and there's a console. And that console basically controls the vacuum, and it fires the energy when required. So what is the purpose? Just a bit of the handpiece also. This is a silicone cup that adheres to the lens, anterior lens capsule. And once it adheres to the anterior lens capsule, what happens is that a vacuum is built up, which is controlled by a console. Very easy. Even your assistant can do that. And once you get a firm grip on that, you can fire that energy, which is emitted in micropulses for a very brief period of time, and that does the job. It's simple as that. Now, when we see that as a video, as a real-time video, this is how the handpiece is inserted. Once inserted, it is unfolded. The the suction cup is unfolded. It is apposed over the anterior capsule, gently apposed. The Purkinje image is taken as a reference point. The centering is done, and once the surgeon is confident about the placement, a vacuum is created, which is guided by the console. And once that is done, you can see air bubbles coming out when that vacuum is created. And once that is done, you fire the energy. You fire the energy, and the job is done. Just few seconds. So no tension. Such a tough thing done in few microseconds. And finally, you get an outcome like this, and not once, not twice, every time. And you can assure your patient really a with confidence a premium IL every time. So at the end, to sum up, I would say why Zepto in intumescent cataract? It is safe, as I have discussed. It is precise. Every time you get the same size, it is well-centered, and it is not only well-centered, it is well-centered all around 360 degree, and it is also, it can be done in certain conditions, complicated conditions like corneal opacities in small pupils where we literally struggle. We don't know the size of rhexis at the end of surgery if we are not using any pupil expanding devices. So in such cases, Zepto comes in very handy, and we can manage our cases very easily. So I advocate for Zepto Capsulorhexis in these difficult cases.